This segment is sponsored by VA Unified Command Health Equity Work Group.
We're joined today by Dr. Janice Underwood, Chief Diversity Officer with Governor Ralph Northam. We're talking today about the Virginia Unified Command Health Equity Work Group. It is wonderful to see you, Dr. Underwood. Thank you for making time.
Thank you for having me, Jessica. We're so honored to talk with you today. While I'm here by myself with you, I just want to say that the Health Equity Working Group is really 60 plus folks, stakeholders around the state, and is chaired by Sable K. Nelson. And so they're definitely with me in solidarity.
Both of you incredibly busy, incredibly hardworking with this particular work group and all the things that you're engaged in right now. But for the good of the group, individuals who may not be familiar, let's talk about the work of the Virginia Equity Task Force and the Health Equity Working Group and what this means, why these were created and the work that's being done.
Well, thank you for the question, Jessica. Governor Northam, as the only doctor who serves as governor in the nation, along with the state health commissioner, Dr. Norm Oliver, knew well in advance that when COVID-19 hit Virginia, that we were going to see a disproportionate impact in communities of color and very vulnerable communities, at-risk communities, those with elevated risk. And so what they decided to do at the very onset of the emergency declaration was create proactively, might I add, a health equity working group and a health equity task force. And the reason why that's so innovative is because we are the only state in the nation that did this proactively. We are operational in nature. We are not academic or political. We are only concerned with saving lives and livelihoods. And so the extent to which the Health Equity Task Force, which is a 5-person committee, provides leadership to the Health Equity Working Group, a larger advisory group with about 60 stakeholders that represent all sorts of elements in our state with regard to state agencies, advisory boards, faith leaders, private human services agencies, advocacy groups. We lead and make sure that equity is threaded through the entire Unified Command in all decision-making, both vertically and horizontally. So we are the only operational task force in the nation, and we're learning from everyone. So we're meeting with other states, we're learning what other states are doing, and we're sharing what we're doing. Because what we know is inequity had a 400-year head start of us, but we're trying to institutionalize equity mechanisms that can fight against inequity.
It is critically important to expand that conversation and to have a variety of perspectives so that we can approach this in a whole way, isn't it? Without those voices, you're not getting the full picture.
Absolutely. We also know that many people don't know what it means to lead with an equity lens. It's certainly something popular to say these days, that everyone seems to understand that and underscore the need for a health equity task force or call for a racial equity task force all over the nation. But these are issues for which Virginia, under the Northam administration, we have begun to deal with breaking down systems of inequity that have been institutionalized over the last 400 years right here in Virginia. So simultaneously, we want to respond to the COVID-19 response, but as well as confront those systems that we see, such as inconsistent healthcare and quality healthcare to very historically underserved communities. How do we change that? How do we meet the needs of all Virginians in a way that in the very next emergency response, we don't have to deal with this in terms of disproportionate impact to communities of color?
Dr. Underwood, we're almost out of time, but thinking about this question, this task force is engaging the community, reaching already more than 25,000 Virginia residents by taking on some of these initiatives. You've just had some successful Facebook town halls. You have one on the horizon. This work is very important.
This work is so incredibly important, and the Health Equity Task Force and Working Group prioritize community engagement. So we've had community engagement calls reaching, as you said, over 25,000 people. But we also have been going into communities using mapping technology to find out exactly where those vulnerable communities are. And we have been making sure that 20,000 masks, 20,000 bottles of hand sanitizer are going to the most vulnerable. So for example, in the city of Richmond, the city of Harrisonburg, the city of Chesapeake, and we have plans to go into the city of Petersburg and Roanoke. And then next we are headed to Northern Virginia next week. We are literally doing the work and rolling up our sleeves because we want to make sure that the needs of all are met.
Working across the Commonwealth. Dr. Janice Underwood, thank you so much for making time for us and talking more about the Equity Task Force.
Thank you.
We appreciate it. We'll share some more information on our website, WTVR.com/VTM, so you can learn more and share your insights.
For more information on VA Unified Command Health Equity Workgroup, you can give them a call, 804-786-2211, or find them online at governor.virginia.gov/diversity/equity-leadership-task force. You can find them on social media too at VDH Just Health and at DEI_Virginia. Stay tuned. We'll be right back.